Hi, this is E. David Crawford, Editor-in-Chief of Grand Rounds in Urology. During these very difficult times, a number of technologies have emerged, and one that has sort of been in the backdrop has been the whole thing about telehealth and telemedicine. And to discuss this today, it's my real honor to introduce Dr. Neil Baum, who is a clinical professor of urology at Tulane. He's author of a number of textbooks, including one on marketing your clinical practice ethically, effectively, and economically. Now in its fourth edition, he's written a complete business guide to successful medical practice. He has been in Urology Times for years with the popular column Bottom Line. And Neil has always been on the cutting edge, and with all the things happening with telemedicine and telehealth, Neil's going to give us a sort of an overview of the etiquette of that. Neil, thanks so much for joining us.
Thank you, E. David. I am delighted to participate in this Grand Rounds of Urology. I have watched several programs in the past, and it is a real honor and pleasure to be able to communicate with your viewing audience. You know, times are really changing, and the COVID-19 virus has produced, I think, two huge changes in healthcare. The first is that the reputation of the healthcare profession has been escalated significantly during these turbulent times. I think the public now really appreciates how incredible the physicians are who go out every day on the line, risking their lives to taking care of patients. The second thing that the virus has done, it has put telemedicine on the map. This is going to be a new way to communicate with our patients that has been relegated in the past to dermatology, radiology, and communicating with patients at a distance from the practice. We have, as a result of using telemedicine, a new approach to patient care. We are going to change the direction of how we communicate with patients, and we're going to move from our offices to the computer. We are going to find that it is possible, even in urology, to have a communication with patients without being face-to-face with the patient. I hope I can point out to you in the next 5 minutes that good urologic care is possible today without the necessity of touching the patients. I have looked at schedules of urologists and have noted that there are a large number of options and opportunities that we have to take care of patients online. I'm not going to go through the whole list, but I want to point out to you at the bottom, post-operative patients. We have in the past taken care of minor procedures using the telephone. For example, a vasectomy done in many urologists' office. Usually we don't make the patient, if it's uncomplicated, come back to the office. We have a phone conversation and they get a semen analysis, and we're very comfortable with that. I think it's even possible to take care of penile prosthesis patients if it's uncomplicated post-operatively without seeing the patients. Yes, it's going to be a challenge to teach the patient how to inflate and deflate the device using telemedicine, but it is possible. It is possible to teach patients how to remove a drain or how to remove a Foley catheter if they're instructed preoperatively on this procedure. And I have now read articles where radical post-prostatectomy patients have been cared for post-operatively using telemedicine. In order to make an effective telemedicine communication with your patient, you have to prepare for the visit. And that includes having good equipment. A microphone has to be a good microphone, that there is good quality of the verbal communication. There has to be good bandwidth and connectivity. And all that means is that your telemedicine program has to launch very, very quickly, and there has to be a clarity of the image with no distortion of the image. Be careful about your lighting. I have seen people who do telemedicine with a window open behind them, and that puts the physician in the dark. You want to make sure that there is no glare. You want to avoid all distractions, including turning off your phones and the phones in your office or in your home. You want to minimize other noises. I have done telemedicine visits in my office, and my office is right next to the employee lounge. And unless I notify the employees that I am speaking, they will be making noise back there in the lounge that can be picked up on the computer. I also recommend, just like a face-to-face visit, that the urologist review the record of the patient before the visit, so you are looking at the camera and not at the computer or the written record. This slide points out that you should have a plain background. If you have a background similar to this slide with your books or distracting material, patients will be looking at the titles of your books and not at you or watching or paying attention. I think it's important to emphasize that if you're going to have a telemedicine virtual visit, you need to look like a urologist. I think the minimum is at least a shirt and tie with a white coat, at least a white coat to make yourself look like a doctor, or a scrub suit. Make every effort to play the part of a real urologist. Advice that I'd like to give you is that when you're going to do a telemedicine visit, give it your undivided attention. This is not a time for you to multitask, answering emails, looking at your cell phone. Don't eat or drink coffee during the visit. You wouldn't think of taking a cup of coffee into a room, an exam room, when you are having a face-to-face visit. Don't do that while you are having a virtual visit. And don't show any signs of boredom, such as yawning. Final advice is you want to be sure, just like in a face-to-face visit, that you answer all the questions before terminating your virtual visit. When I was seeing patients in the office, I gave them a card, or a card was given to them, a 3x5 card, and they were told while they were in the reception area or the exam room to write out 3 questions that they would like before terminating the doctor-patient encounter. You don't want to have, just like in the office, what's called the doorknob phenomena, where you are ready to leave the visit and the patient has one more question. Make sure that you take a moment to be sure that they answer all questions. When you are preparing the patient for a virtual visit, you can recommend that they write down the questions that they would like to ask during that virtual visit. The final best advice for a virtual visit is to be on time. Just like it's important on a face-to-face visit, the doctor should make every effort to be on time, demonstrating to the patient that their time is just as valuable as physician time. If you are going to be significantly delayed, have someone in your office contact the patient who is probably waiting by their computer for your call and give them an estimate on what time you will be available. In summary, virtual visits are really going to be no different than a face-to-face visit with your patient. The main difference is you won't be able to reach out and touch the patient. It is still possible to manage dozens of patients. Nearly 50% of patients that you are seeing in a general urology practice can be managed with a telemedicine or virtual visit. However, you must focus on your patient and on that visit and give it your undivided attention. So in conclusion, I think it is imperative that you take the time to prepare for these visits, to give it your focused attention. I think it's very important that you document these visits very, very carefully. I think it's important, and Mark Painter has pointed out very nicely the importance of accurate coding for these virtual visits. And if you take a few of the suggestions that I have provided you and you document carefully that virtual visit and code it properly, you will certainly hit your target. In conclusion, I'd like to offer you my email address. Those who would like a copy of the article on teleetiquette, if you contact me, it would be my pleasure to send it to you. I thank you very much for this opportunity to communicate with you, and I turn it back to E. David.
Neil, thank you so much. As always, we learn a lot from you. What a great number of tips and things that I didn't even think about. And you're absolutely right about the focus and how you behave and so forth. And I think many of us have not thought about that in that detail. Also, in Grand Rounds in Urology, we had a very good interview with Mark Painter on billing and coding, as you are aware. One question I have before we let you go, and that is that there are a number of, I don't know if you want to call them point of care, but tests that can be delivered to the patient's home. And I'm seeing things like flow rate machines, not machines, but a device. We're seeing things like bladder cancer testing, some of the molecular testing and things like that. Any comments on those? I think there are going to be more and more of those things happening.
It is possible to monitor a patient, let's just say for BPH, a patient with a flow rate app. And I will get you the name of the app, but you put your cell phone by the toilet and you're told, the man is told to urinate into the water in the toilet bowl, and it picks up the sound, and it is a reasonably accurate measurement of the flow rate. So in the past, we had to, just use verbal. Now there are apps and home devices. There are fertility tests that can be done. There are semen analysis tests that can be done in the home that are reasonably accurate. There are urine dipstick tests that can be done. And that number of procedures that can be done in the home is going to increase significantly in the near future as telemedicine becomes embedded into every urologist practice. It's not a question of if you're going to do telemedicine. The time has arrived is when you're going to pull the trigger and do it. You can safely, efficiently, and productively manage your patients using telemedicine.
Wow. The whole new industry is going to evolve with delivering points of care things, the stuff that you talked about. I never even heard about that flow rate with your phone. Sort of goes back when we started in urology, asking patients if they could make foam in the toilet, and that was sort of our end point about whether they had BPH or not before we had AUA symptom score. Neil, thanks for your time. Any other further comments before we leave?
I'm good, and please invite me back.
I will do that. Thank you so much, and I hope all is well with you down in Louisiana and New Orleans. Take care.